All right, this is going out there to, I guess, all the Swifties out there that looks like you might be getting involved in politics, which is a great thing. That's what we need, more young people into politics to shape the future of the country and all that kind of good stuff. But I want to talk to you about those policies and your support for a president in terms of Social Security and Medicare. My name is Ed Weir. I ran the third busiest Social Security office in the country. Before that, I worked for the Department of Social Services doing Medicaid. Long time ago, I was a sergeant in the Marine Corps and also an adjunct professor of as well. So I've got an interesting background, but I want to talk about Social Security and Medicare specifically here today for all the young people. And what we're going to do is this is a live broadcast. You can tell this is not edited, and I do these pretty much several times a week, every day recently. We're going to talk about your involvement in politics and how you're going to help save Social Security and Medicare for your parents and aunts and uncles and relatives and community, and for you and for your grandchildren. And at the end of it, there's also a live Q&A. So if anybody here has questions at all things Social Security, retirement, disability, survivor benefits, spouse benefits, make sure you type it in the chat and I'll get to it after I talk to all the Swifties out there. Number one, who cares about Social Security and Medicare? That's your question, because you're young and you're going to live forever, and who cares? And it's not going to be there. We've been hearing that since basically 1935, 1936, when Social Security started. Who cares? It's not going to be there. The money's not going to be there when I get, 60, 62 years old. And this is a life lesson here. Who benefits when you think things like that? Who wants you to think that? Over the last many, many decades, since day one, Wall Street has wanted Social Security money. They don't want you to put it in a safe investment like, where it is now. They want to gamble it on Wall Street. So they have been trying to get rid of Social Security forever. So they're playing kind of the long game now and trying to erode trust in the system. So young people will say, okay, who cares? It's not going to be there in the future. So just go ahead and give it to Wall Street so they can take it to Las Vegas and gamble it away. So that's who really wants you to believe that. Don't worry about it. It's not going to be there in the future. But Social Security will always be here in one shape or another. The trust fund, you've probably heard about the trust fund, being depleted. But that was a purpose. The trust fund was specifically built up for baby boomers, those born between 1946 and 1964, and it's being used by baby boomers. The problem going forward is demographics. Y'all are having less kids, your parents had less kids, and there's income going to the millionaires and the billionaires, kind of that income inequality here. So number one is Social Security is always going to be here as long as people continue to work and pay into FICA. As long as we don't privatize it and give it to Wall Street, then Social Security will always be here. And I've taken hundreds of thousands of retirement claims in my life at Social Security, and I can't tell you how many times people have come in at 62, 65, 67 or something and said, wow, I wish I would have known X, Y, or Z, 50 years ago. I wish I would have thought it was going to be here, and I would have, did a little bit better in terms of investing for retirement. So that's one of the reasons I wanted to get out there and do this crazy video for all the Swifties out there, the younger people. And number two, so there's three things I want to talk about. So the number one is you should care. Number two is your mission is to make sure it continues to be there in the future. And you're currently Taylor Swift endorsed one particular political candidate, and make sure you check out her particular plank, her platform on Social Security and Medicare, which I personally agree with, is raising the cap. Basically what it is right now, one of the biggest problems with the future of Social Security is it's, again, lower population, but more of the money is being used, the income is by millionaires and billionaires. And that doesn't get taxed in FICA. So anything over $168,600 this year, you don't pay tax on it. So all y'all, 99% of the people watching this right now, pay FICA on all your income. If you make a couple of $1 million or $100 million, you only pay, those people pay the same amount essentially you do, up to 168,000. So they pay less than 1% while you're paying 12.4% of your tax of your income as taxation. Part you pay and part your employer pay. So that's the issue, that we need to raise the FICA max so more people pay into it, pay into the system, just like the rest of us. Or the other option is y'all go have a second baby boomer and more people come into, but I don't think that's going to happen very soon. And this is critical. The reason I want to talk about this now is because in 2034, that's when the trust fund runs out, and we don't have that surplus there to take care of people in the next 10, 9 or 10 years, which is coming very, very soon. Was it 9, 10 years ago, the Reverend with Leonardo DiCaprio? That was 9 or 10 years ago. So time flies. So this election is extremely important. So it doesn't matter who you vote for. Your job is to poke them with a sharp stick and say, hey, you're my politician. Here's what I want you to do. I want you to protect Social Security and Medicare, so it's here for me when I retire at 60, 62, or your children or your grandchildren. This election is probably one of the most critical ones for Social Security and Medicare in a long time. So we need to make sure that it's protected. And here is the big one. I'm going to make you a hero now. And before I make you a hero, I want to talk about one last thing that's important to you. Your future. I know you're young, and being 60, 62 or whatever, it happens in a heartbeat. I was a young Marine Corps sergeant a few years ago, and now I think I have more hair than I had then. But anyway, when you do your taxes every year, make sure you check your Social Security statement as well, because that's how Social Security determines how much you will receive in retirement, or your spouses, or your surviving spouses, or even in disability, is what you paid into Social Security, the FICA tax. And if it's wrong, somewhere along the way it gets missed, then you're going to lose money for the rest of your life. So when you do your taxes every year, make sure you do one more step. You go into ssa.gov and check your record to make sure that last year's earnings made it to Social Security. Just double check that, please. Too many people are losing money because they didn't check that at a younger age. Okay, here's how you be a hero. All the Swifties out there, you want to get involved in your community and take care of your relatives and your friends and everything like that. A lot of people are missing money from Social Security. Social Security is understaffed right now, 27-year low understaffing. I think that's a political decision. You ruin customer service, and that deteriorates, support for the agency as well. It's like, oh, they're doing a terrible job anyway. Yeah, they were designed to do a terrible job, and they're being understaffed. And, that's part of the process, kind of the insidious underlying program to kind of get rid of the system, to destroy customer service. But anyway, because of that, and because Social Security policy is extremely difficult, there's over 20,000 pages of policy. A lot of people are missing money. They're not getting the benefits they're entitled to. I do a live Q&A, which I'm about to start here in a bit, and I help people navigate the bureaucracy to make sure they get money they're entitled to: survivor benefits, spouse benefits, disability, Medicare, Medicaid, and all the rest of it. So here's how you can be a hero. Make sure you tell your friends and family. If you hear your uncle or grandmother saying, oh, I wonder if I'm getting the correct amount. My husband just passed away. How do I do this? Tell them to come to my channel, join my live Q&A, put a question in there, and I'm more than happy to walk them through the entire process. And I also have over 700 videos that I've uploaded over the last year on all things Social Security and Medicare. So watch them or join my live Q&A if you have specific questions or needs. All right. So I didn't want to spend a lot of time. 9 minutes is probably a lot for Swifties out there. I'm talking about boring Social Security and Medicare, but let's go into some questions. All right, let's see here. Colin, there's a question: to turn 62 the first week of December, do I put December or January for the first month? I want benefits to start on my online Social Security benefits application. Prefer the earliest possible. So you have to be 62 the entire month. So if you turn 62 the first week of December, you cannot get benefits for December. You have to get benefits for January. So your first month of entitlement is January. That's only when you turn 62. If you're 63, 64, whatever, it doesn't matter. But 62, you have to be 62 the entire month. So your first month of entitlement is January, and your January check will come in February. You were born in the first week, so you'll get your check on the second Wednesday of February, and that's how that works. All right, let's see what other kind of questions we have here. A lot of questions. Good, good, good. Rebecca, what's up, Rebecca? I'm 60 on SSI. When can I apply for benefits from X? He's already receiving his Social Security. 62. I assume he's still alive and kicking out there. If it was a survivor claim, you can start at 60. But it's sounds like he is still alive, so you have to wait till you're 62 to file. And you say that he's already receiving Social Security. That doesn't really matter. It's called independently entitled divorced spouse. If you are receiving your benefits and you have a divorced spouse that you were married to for 10 years or longer, as soon as they turn 62, you can start receiving your benefits. And there's a lot of people out there that are not receiving those benefits because they think they have to, their ex has to file for those benefits. That is 100% incorrect. Too many people are losing money. So Swifties, if you're still here, there's one of 400 different ways people lose money, unfortunately. Lori, they clearly didn't have the long game of the future in their thoughts when they developed it. It's been around here for 90 years. So it's, so it's pretty good. Again, the trust fund was built for a specific reason, to take care of the baby boomers. So, but they missed those two calculations. They missed the fact that they thought that people would have more babies. How can you predict that in the 1980s? And number two is, at that time, 90% of income was subject to FICA tax. They didn't realize the rich would be getting so crazy rich. Yeah, so that's what the two things they missed. Sylvia, my ex died May 2023. I just filed for divorce spouse benefits September 2024. How does it take for my first payment? I'm 63 years old. Do I get back payments? Yeah, it really depends when you call them, whether there's any protective filing there. Probably you won't get any back payments back to May or June, unless you call them around that time. Yeah, it's if you've already filed the claim, that's just a easy divorce spouse benefit. If you've already provided them the proof, the marriage certificate and the divorce decree, it doesn't take very long. I've done hundreds of thousands of those. But again, Social Security is understaffed. So once you put the application in the system, it takes 5 minutes to adjudicate it. So, and then your check's in the mail. So, but again, Social Security is understaffed. So there's that. Penelope, answering a question for Colin. I appreciate it. Penelope is always awesome. Peggy, appreciate all you are doing. I had called and asked to be on your list for Advantage Plan review. When is the cutoff date for Social Security admin on those plans? Please call. Yeah, I've gotten a lot of calls. And Peggy, yes, I think I got, you called. Yes. So if you called and left a message, or you emailed me at that email right there, or where else here, or you click on that little QR code thing there. The Medicare season starts October 15th. The new plans come out on October 1st. And this is going to be, the craziest Medicare year than for a long time, because there's so many different changes. Everything, a lot of companies are moving out of entire states, entire regions. And there are these, Medicare insurance companies hope you don't check your plan. They just hope you just forget about it. And and then you're going to be surprised next year. So if you want, I've put together a Medicare insurance broker team that helps people throughout the country. If you need help, just click on that button and fill out a little form that says, hey, call me in October when the new plan comes out. Email me and say, hey, contact me in October when the new plans come out. And we're about to start reaching out to those people and setting up a time to review their plans. Again, that's 100% free, and see if there's any surprises in there. And obviously, we want to keep your doctors, save as much money we can on your prescriptions, and see if there's any more benefits, and make sure your current plan is not going to cost you an arm and a leg next year. Again, most of the Medicare Advantage are zero premium per month. But what I mean arm and a leg is, this year it might be, if you go to a hospital, it's $100 a day. Next year they might say, okay, now it's $500 a day, or it's another $100 to see a specialist, or $300 for MRI. And That's the surprises you don't want. Chrissy, I am 61 years old and on disability, married for 30 years. My husband is 65 and retired now for 3 years. Do I apply for Social Security under his number when I turn 62? Yes. Yes. So you can receive disability. Again, that's another thing a lot of people miss is they think because they're receiving disability benefits, they can't receive spouse benefits or divorce spouse benefits or whatever. You can. If your husband or ex-husband in your case is benefit amount is twice your full benefit amount, then you're entitled to some money on his record. It really depends on how much. But yeah, when you get 62, about a month or so before you turn 62, call Social Security and say, hey, I want to file a spouse claim on your husband. Yeah, and they'll get you some more money and you'll keep your disability. And because you have disability, you'll keep your Medicare. So you have disability Medicare, but on top of it, you'll have spouse benefits or divorce spouse benefits or surviving spouse benefits, whatever. Sylvia, I'm on disability. My ex died May 2020. I just filed for divorce spouse benefits. How long does, oh, okay, I just answered that one. Rhonda, I was on disability since 2012. My husband passed away 2020. Now it says I get SSI and survivors. They forgot to pay me the first year after he passed. Yeah, SSI is the welfare-based program that you can get a max of 943. So yeah, if you're getting SSI, I'm not sure if you meant SSI. Everybody always confuses that. They think SSI just means Social Security income, but it's actually supplemental security income, a welfare-based program. My husband passed 2012, and survivors, they forgot to pay me the first year after he passed. Yeah, if you think you're entitled to back pay, retroactive pay, then definitely, when you get the letter that says, here's how much we're going to pay you, this starting this month, and this is the amount and everything, at the very bottom of the letter, it has your appeal rights. And you just fill out, it's a simple form. It's SSA 561, some pretty easy form to fill out. And you just return that and say, hey, I think I'm entitled to this, that, or, in your case, back pay. And it usually there's appeal. You have to do it within 60 days, 60, 65 days, mail type thing. But you can always request what's called a good cause. You just write a little letter that says, yeah, the reason I didn't do it within the 60, 65 days is because I didn't get your letter, I was sick, or I was traveling, or whatever the case may be. So Barbara, it does matter who you vote for, young and old, in 2024. It makes a matter of life and death and free America much more. Okay, yeah. Get involved in politics. It's a beautiful thing. Sally, baby boomers are getting raw end of everything from what I've seen from. So why didn't they warn us about the means testing on our 23 taxes? Yeah, I don't do taxes. All right. Well, does it matter if you file taxes as single or divorced? Yeah, I don't do taxes. Yeah, there's too many people out there that give Social Security advice. There's a bunch of, social media YouTubers and TikTokers that give Social Security, advice. But, yeah, I spend a lot of my time correcting those people. Yeah, giving out so much information. Yeah. Rhonda, they forgot to pay me the first year after he passed and took $84 out of my check. I still only get $9.48. I don't understand why it changed from disability to SSI and while I still only get $9.48. Yeah, if you only get $9.48, that sounds like it is SSI. Probably $9.43 you meant. The max you can get on SSI is $943. So people can get SSI and SSDI. So how it works is SSI is the welfare-based program. And for those on disability or aged is anybody 65 or older. So because it's a welfare-based program, low income and low resources. So if you get regular disability, but your regular disability is, let's say, $500, that's less than $943. So they give you your $500 on disability, regular disability, and then they give you another $443 for a total of $943. So you can get SSDI and SSI. And because you got SSDI, you also get Medicare. And because you have SSI, you'll probably get Medicaid. So you'll have SSDI, SSI, Medicare, and Medicaid. So all those things working, sometimes together, sometimes not. And that's why I've come out to retirement and, yeah, helping people make sure they fill in all the pieces of the puzzle. I was born in 1964. When is my full retirement age? 67 years old. Uh, Quit saying to Swiftie she's an entertainer and she's not an expert. Yeah, I never said she was. I said I'm an expert in Social Security, and I'm appealing to those young people out there that are getting into politics. So there's that. Joseph, please hit the thumbs up button. Let's go out to more people. Yes, please. I've been trying to get at something and trying to appeal to the young people to tell them, you got to save for retirement. You got to make sure you check your earnings record. I've too many people, getting out there that are not getting the benefits they're entitled to because when they were young 20s and 30s, when you're young 20s and 30s or so, you're going to live forever. So you don't care about retirement. So you don't check your earnings record and they're getting the wrong amount. So figure out, use this as an opportunity to reach out to the young people. I'm 64 and I'm on disability. Should I file for retirement now? No. 99% of people just stay on disability because if you file for retirement, you're going to get less money because you're 64 and you're going to be filing for early retirement. So you'll have to stop your disability and file for less money. If you want to do that because you want less money, because maybe you want to go back to work and you don't want all the disability limitations, or you're tired of being called, disabled, then you can file for retirement, but you're going to make less money. Kathy, the spousal benefit isn't working out. Oh, okay. I think you put a remark on there that, on one of the YouTube comments I saw. So SSA said that if my SSDI is more than the calculated benefit of 32%, then I keep my SSDI. Yeah. So it sounds like your Social Security disability benefit or whatever your benefit on your own record is more than half of your spouse's. So if that's the case, then yes, you do not receive your spouse benefit because your spouse, I assume, is still alive and kicking. So, but that changes. There's another reason a lot of people miss money is because they're told they're not entitled to benefits like you. Okay, you're not entitled to benefits right now. What do you mean not entitled? I was married to the person, yada, yada. Yes, 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 yes. But there's no more money in the sense of that your ex's benefit amount is not twice yours. So you're not entitled because there's no money left there because you can only get up to 50%, top at 50% if you waited till your full retirement age. However, so a lot of people are told that and then they go on there with their lives and their ex passes away and now it's no longer 50%, it's 100%. So Kathy, doesn't sound like you're entitled to benefits now because there's no more money there. But if that person ever passes away, then I would definitely 100% call again because it sounds like you're entitled to benefits as a surviving spouse. Guadalupe, I am in a state registered domestic partnership. My partner receives SSD. Am I entitled to spousal benefits? It really depends on your particular state. Every state is a little bit different in terms of common law. So if your particular state recognizes common law marriages and you are at least 62 years old and they are 62 years old, then you are possibly entitled to benefits. Depends on how much your benefits are and everything and how much that person's benefits are. Bonnie, sorry, got cut off. From what I've seen of the Swifties, they won't need it and don't really care about anyone but themselves. I would like to know how to get it on disability. Okay. At 7, I realize that. Yeah, if you're 72 years old, you can't get disability. There's nobody in the country that is receiving disability after their full retirement age. Once you hit your full retirement age, disability is automatically switched to regular retirement benefits. Nobody notices the difference. It's just a kind of an accounting thing. All right, let's see here. Yeah, I thought I would never retire, right? Laugh a lot. It creeps up on you. I turned 60 this Thursday. Oh, well, happy birthday. Yes, I know exactly what you mean. It happens before you know it. Yeah, I'll be 60 next month, and I can't believe it. I have severe cirrhosis on arms, and it's hard for me to do a job. So yeah, this is a common question I get. People will say, I have this disability, I have this issue, can I get disability? I always say file. It doesn't hurt to try. Because usually what happens is people say, well, I have this particular issue. Does that qualify? And, if it's like cancer or something like that, then yeah, obviously slam dunk. But some people have kind of a borderline type thing, but then they have two or three other minor issues that they think is minor. But if you put those two or three things together with this other more major thing, and you have medications that had these side effects, and you're this particular age with this particular background and this educational background, you just might be approved. So I would say apply. And I've done 3 or 4 videos on how to apply and all of the tips, tricks, and secrets I've learned over taking hundreds of thousands of claims. So, is it true that there's a $2,000 cap on prescription drugs in 2025? Yes. So this year the cap was $8,000. Next year they're going to make it to $2,000, and that's one of the big reasons why there are going to be so many changes next year for Medicare Advantage plans and Medicare Part D plans, is because of that. And there's other um, all kinds of other things that CMS have come down with, and companies are pulling out, and they're looking for more profits, and so they're pulling out of particular areas completely and dropping plans. So this month, September, this is when you're going to get your ANOC. If you have a Medicare Advantage or a Part D, you get your ANOC. It's the annual notice of change. It'll tell you about all your changes for 2025. Most times people just throw those away, but yeah, this is not the year to throw those away. If you need help going through it, email me, click on that little link there, and we'll put you down as soon as the new plans come out. Review what you got with what's available for next year. And if we can find you something better, that is a beautiful thing. Uncle Ed, what's up? Uncle Ed, a quick one. I believe I heard you mention I'm 62 on SSDI for 2 years, divorced. She passed 2013. Anything to claim there? Possibly. Yeah, you could get possibly get survivor benefits, as early as 60 years old. And yeah, how if you had to be married to that person for 10 years, or yeah, so you are divorced, so you had to be married to the person for 10 years. And if their benefit amount is twice your full benefit amount, then you could very well receive extra benefits. So the best thing to do is call the 800 number, that 800-772-1213, and give them that person's information, the name, date of birth. If you know the social security number, it's easy, but if not, no big deal. Just give them that person's information, and they'll find the social security number, and they'll tell you if there's any more money. That is, if that benefit amount is twice yours. And if it is, they will schedule you an appointment. Or actually, no, this is a surviving one. It's 100%. So you can get up to 100%. You won't, because you're filing early. But yeah, they'll tell you whether there's any more money there. And if there's more money, they'll schedule you an appointment. So my son is 18 now. I'm 63, receive SSDI. Can he get benefits in college? No. There is a proposal out there because it used to be to where kids can get benefits like that until college, but they stopped it. Now it essentially stops at 18, unless your child is still in high school. If your child's still in high school, it continues until they graduate high school, or 19 and 2 months. If my ex-husband isn't 62 yet, can I still get half of his Social Security? No, he has to be at least 62 years old. And remember, he doesn't have to have filed. If he's going to wait till 65 or 70 or whatever case might be, no issue for you. You just have to be divorced from that person for 2 years. And as soon as that person reaches 62, you have to file for benefits on your own record, and then you can file for spouse benefits. I'm on disability and need to know how I get all my benefits. I'm 66. Yeah, pretty soon you're going to lose your disability, which is a good thing. You're just going to be switched to regular retirement benefits once you hit your full retirement age, 66 or 66 and 8 months, or whatever it is for you. So your benefits are going to switch from disability to regular retirement. It's going to be the same amount. You won't even notice the change. It's going to be the same amount, same pay day, same direct deposit, and all that kind of good stuff. But some good things is No more CDRs, those continuing disability reviews, no more work limitations. You can do whatever you want. Social Security doesn't care anymore because you're receiving retirement and you're after your full retirement age. So, yeah, go out there and enjoy your life. All right. Let's see. Sir, hope you had a lovely vacation. Yes, I did. And are rested. Yes. I'm from California and on SSDI since 55 and is receiving 1,600 a month. For how much do I? Yep, sorry, I don't do taxes. But yeah, up to 85% of your Social Security is taxed. But 40 to 50% of people don't pay taxes on Social Security. If your income is just basically Social Security alone, you probably don't pay taxes on it. Mayo Hospital in Arizona only takes basic Medicare plan, the red, white, and blue card, and we have a secondary plan under my husband. Yeah, that's one of the big things is Medicare Advantage. If you watch any of my videos, you always know I recommend Medicare supplements first, Plan N, Plan G, and then Medicare Advantage after that, because hospitals and you got prior authorization, hospitals are dropping them, but unfortunately, there's a lot of people that just can't afford the monthly premium for Medicare supplements, and that's just a reality. I wish it wasn't the case, but hate to be the bearer of bad news, but Medicare Advantage plans have not always been zero premium. About 10 years or so ago, the plans you had to pay monthly premium for those, 20, 50, $100 or so. So I think in the future that's going to come back. But unfortunately, people get the zero premium now because that's all they can afford. And they get away from the Medicare supplement. And then maybe 5 years from now, 10 years from now, they're going to have to pay for that Medicare Advantage plan. And they can't go back to Medicare supplement. So not only are they going to have to pay for it, but they're stuck with all the networks and prior authorizations and, hospitals not taking it. So I think it's going to be, yeah, it's not good. We really need to do something in this country about this. So Swifties, get involved. Thanks for sharing your wealth of information. I truly appreciate it. You're welcome. All right. Thank you for everything you do. Yeah, I appreciate it. Thank you. My husband is 68, gets 2,700 on SSDI and my SSDI. And is there anything to file and get more? No, because yours is what, 30? Yeah. So his benefit amount is not twice yours. And that sounds like it. See, if you're having, yeah, I was going to say if you're having difficulty paying for your Part B, you might file for Medicaid, but it looks like you're making too much there for Medicaid. And make sure you watch my video. Let's see here. Let me see if I can find it. I did. Let me take this out here. This video on the bottom there, how to live on Social Security. I did a 4-part series on that, how to live on Social Security alone. But I took all 4 videos and I went through the list. There's probably close to 50 different programs that might make your life a little bit easier if you're living on a fixed income. So watch those, and then you can go back to the 4 videos I did. Ignore the super long introduction. I suck at YouTube, but my introductions sometimes are too long. Sorry. But it goes more into detail on those specific the programs out there. So make sure you watch that, and yeah, see if you can get some more money out there. All right, let's get back here. No fancy studios or assistants, just me and my son. All right. Let me see. Hi, if you do not have 35 years of work, will additional 4 credits add to your future Social Security pay? If yes, do you know the exact amount? No, it does. Yes, 100%. If you have 34 and you put in another number in there, so you would have to know how much you made over those the other 34 years, and how much your new year is going to be. And then what it does is they index those for basically a kind of a wage index. So your earnings in 1975 are indexed for earnings essentially today. And then they take the average of that and calculate it out. But anytime, yeah, it's just simple math. If you replace a 0 year and put money in there, then that's always a good thing. However, It's probably not going to be, 6,900 is probably not going to make that big of a difference. Yeah, not a big difference. But hey, every buck's a buck. Okay, yep. All right. Dr. Christopher, what's up? I was previously disabled and received Social Security disability benefits from 1991 to completing the Social Security ticket to work in 2008. Now, 2023, I reapplied more than 5 years receiving benefits, 300 days and no news. Any advice? Um, so you stopped in 2008, so you couldn't do, it sounds like you couldn't do an EXR, expedited reinstatement, because you can only do an EXR, expedited reinstatement, within 5 years. So you just had, yeah, you had to file again, all over. 300 days and no news. Wow, that's unsat, as we used to say in the Marine Corps. That's unsatisfactory. Um, Especially if that's your initial application, because you do the initial application, and if you're denied, then you file reconsideration, and if you're denied, you do the administrative law judge. If this is an initial application, it shouldn't take 300 days. Somewhere they lost it. Yeah, that's that's crazy. Now, it's taken 6 to 9 months, but 300 I would reach out to the DDS, the state DDS, the Disability Determination Service, and find out who your examiner is there, and say, hey, just checking in, it's kind of taking long. And if you hear them shuffling in the background, looking under the desk, then you'll know what happened. But yeah, 300 days is way too long. And if they say, oh, we're still doing it, yeah, it's right here, we're still waiting on this, that, and the other, then I would contact your political representative. 300 days is completely unsatisfactory. And this is why I say a lot of my videos, if you want customer service to be improved, all politics are local. Your local, congressperson, or, the senator, the federal ones that represent your particular congressional district or your state, they're always happy to go put on their hard hat out there when they, bring money in for a new bridge or a new road. Well, tell them to put on their hard hat and go to the local Social Security office and say, hey, let's bring some money to the Social Security office so they can get some staff, and so they can help people, so they can get these lines down in the morning and all the rest of it. So, if we can't do anything nationally, then pressure your local politicians to improve the service in your local office and make sure people don't have to wait 300 days for their disability. So there's my soapbox, and let's move on. Brenda, my 80-year-old sister. There we go. I like this. Always looking out for family and relatives, and takes a community. So thank you for Brenda for looking out for your sister. My 80-year-old sister was just diagnosed with Alzheimer's. Are there any benefits she might be missing? Again, I would definitely check out that video on a bunch of things that might be able to help, 50 programs or so. But in terms of Social Security, if she's getting Social Security benefits, obviously she won't be able to get disability because she's past her full retirement age. If she was ever married to anybody for 10 years or married to someone that passed away, check to make sure, if she's entitled to spouse benefits or divorce spouse benefits or surviving spouse benefits. So. Please like, subscribe, and share. Yes, that's one way we help the community out there. We teach this crazy algorithm to get this information out there to more people. Cats, I just wondered if it affects Social Security the way it has failed. You had mentioned taxes often, so I thought you might know. Yeah, so FICA taxes, yes, FICA taxes, but I think you were talking about income taxes. I don't deal with income taxes, talk about FICA taxes. The 6.2% FICA payroll taxes, but yeah, I don't do the taxes. As I always say, I've been trying to cancel my subscription to the IRS for decades, but yes, please, Taken Took is always looking out there for the community, and he has found, he right now, has found so much money for people by sharing. Cheryl, my children's father died last year. Oh gosh, we never married, but started living together 11 years. I've been on SSDI since 2007. Do I qualify for spouse benefits? He was 67 and just reached. Okay, so not spouse benefit unless you're as a common law state and you can prove a common law marriage. However, You could also be eligible for what's called surviving child and care benefits. So hopefully the children are receiving benefits. And if you have one of the children are 16 and under or became disabled before the age of 22, you can collect what's called surviving child and care benefits. But there's also a family max. So maybe the children are already receiving the max benefit. So I would call Social Security and see if there's any money left over there. Um, um, yeah, again, because there's the max that can be paid out on the record. But if there's, for instance, if you have like, one that's 15 and one that's, going to be 16 here, or one that's going to be 18 and gets off the record. And right now, there's no more money left on the record because the max is being paid out. But one of the children stop receiving benefits because they, get 18 or they graduate high school. Then there's money left over on the family max, and then you might be able to get some of that money. Again, it's called the surviving child in care benefits. So make sure you call and see if there's any money left over there. And if there is, schedule an appointment. Swifties are signing up to vote. It is good for young people to become aware. I wish I would have been better informed when I was young. See, exactly. That's why I did the video today, because I've heard that a few million times. I wish I'd have known this last year or 5 years or 10 years ago or 20 years ago, or I wish I would have found Rogaine earlier. I don't know, one of those things. Yeah, it's more than 5 years. You may need to totally do a new application. Yeah, yes, Deb, exactly. So when you're receiving what Deb and I was talking about, this is called expedited reinstatement. If you were receiving disability and they stopped disability because of your work, because you worked too much, and then you just tried to work, and then within 5 years you just stopped, you couldn't do it anymore, you can file for what's called expedited reinstatement. I don't know why they call it expedited, because nothing is expedited in Social Security, but it's an easier process to restart your benefits, but it has to be within 5 years and it has to be the same disability. So, young people might help save our Social Security benefits. I hope enough people care. Yes, I certainly hope so. And them getting involved and sharing their, this information with their, relatives and community and stuff like that. I think that'll go a long way too. And yeah, make them heroes. So that's always good, and help their family get their money. Still confused after call you. Okay, yep. Just received the 2025 Medicare handbook. Okay. Yes, the out-of-pocket is going to be tapped at $2,000. Lee, web question. If pension taken as lump sum divided, let's say 132 months, after those 132 months, can you go back into Social Security and restore the Social Security benefit back to the full amount? Yeah, if you do a lump sum, I'm not sure we get the 132 months, but yeah, Social Security has a actuarial table that they use. Because some people do that. They take their, the WEP. What he's talking about, Lee, is windfall elimination provision. So that person was working for a state or a county or a state government agency that did not play with Social Security, did not pay into Social Security. So they're receiving what's called a non-covered pension, and that's offset for what if they're entitled to Social Security. But if you take out the lump sum, then you notify Social Security and you say, hey, okay, I'm not going to get a monthly, non-covered pension. I just decided to go ahead and get the entire sum, and it's $100,000. And then Social Security looks at their actuarial tables and they say, okay, for your particular age, your longevity is up to 78 years old or 82 years old. And that's how they figure out how long that should last. And that's how they determine how much the monthly benefit amount will be. But unfortunately, it's forever. So it doesn't cap out. So there's that. Eileen called Social Security today. They said it's disabled survivor benefits. Have phone appointment for 10/16 and keep you updated. Awesome. Yes. The DWIB, disabled widows benefits, the disabled survivor benefits. Same thing. Yes. So Eileen is basically, you can get survivor benefits from 50 to 60 years old if you, widowed, widower, and disabled. If you're not, then you have to wait till you're 60 years old. So yeah, So, yep, but unfortunately, you have to go through the whole rigmarole of disability. So, watch my videos on disability in terms of medical records and all that kind of good stuff. So, you file the survivor claim, and then they'll take the disabled claim as well and ask you about your doctors and what's your disability and why can't you work and all that kind of good stuff. And then it'll take 6 to 9 months to approve. Hopefully, not like 300 days, but yeah. If I file on my benefits at 64, I'm a 1960 baby. Can I pull off my ex's Social Security at 67? Will it be more benefit? His is higher. So yeah, if you file for benefits on your own, then you also have to file for benefits on every other record you're entitled to at that time. You can't really wait. It's called deemed filing. It changed back in 2016. My daughter is 4 and legally deaf and nonverbal. So wow. I have for Social Security, I would definitely check out SSI, Supplemental Security Income, and apply for that and see if she's eligible for SSI. And if she's eligible for SSI, depends on your state, she'll also be what's called categorically eligible for Medicaid from the state as well, the health insurance from the state. So definitely check that out. So how do you do it? You just call Social Security and set up an appointment for a SSI for your child, and like a phone appointment, and they'll call you up and they'll see if they can get you some money and some benefits. All right. So I can make whatever I want at full retirement age, and it won't lower the amount of my Social Security amount. That is correct. It could very well increase it. Yeah, it definitely won't lower it. So you can make $1 billion a month after you hit your full retirement age, and there's no more, $1 for every $2 over and all that kind of good stuff. But you'll always pay FICA unless you're super rich. You'll always pay FICA on those earnings. And if it's one of your high 35 years, then that will actually increase your benefit. So you'll get COLA, the cost of living allowance, increase your benefit every year. And you could conceivably get your basic benefit increase by it's one of your high 35 years of earnings. Lori, the time for SSDI in my state is a minimum of 230 days. They are telling everyone in application, disabled people can't wait 230 days. Yes, that is completely 100% unsatisfactory. We need to do something about that. Again, I think this is a conscious effort by the people that want to privatize Social Security. It's their long game. It's to, build distrust and erode confidence in the system by telling, oh, it's not going to be in there in the future, so give it to us. And then the other side of that coin is to destroy customer service. So you get so frustrated and you say, well, Social Security sucks and it's terrible and anybody can do better than that. And so, yeah, and that's their game plan and they're succeeding. So let's make sure they don't. Call up your local politician and say, hey, thanks for the road, but have you seen the line at Social Security? So my ex will be 62 in December. Can I file for independently entitled divorce spouse now, or do I have to wait until after my ex is 62? Yeah, so your ex has to be 62 the entire month. So the first month you can get benefits. Again, you have to file for benefits on your own record first. You have to be receiving benefits on your own. And then starting January, you can be entitled to benefits on his record. So give Social Security a call next month or so and schedule an appointment for December or January to start getting those benefits. So you'll need the marriage certificate, divorce decree, and all that kind of good stuff. I think long-term state Medicaid helps with home health for people with disabilities on low income. Yes, that is a fact. Let's see. Lori, I have an adult son who is both mentally disabled and has leukemia. Wow. He lives with his dad at age 77 and dad assigned as his money handler. Is there any benefit for his dad being his caretaker? Not from Social Security, unfortunately. There are other ones out there, maybe some state and county ones that can help out. And so IIHS, there's a few states with that, but nothing, unfortunately, from Social Security. So yeah, so his dad is his representative payee that takes care of his funds. But again, watch the video I did on, living on Social Security alone, and there might be something in there that might benefit you. What's a Swiftie? Followers of Taylor Swift. Yeah. Uh, my mom is 80. How can I get her divorce spouses? Can I call Social Security office myself? My dad passed in 1995, definitely married over 10 years. Um, yeah, she'll have to be on the phone. So you can call, just have her sitting right next to you. And then, you say, hey, my mom's here and I want to go ahead and talk for her and, answer your questions and stuff like that. And then you hand the phone to your mother, and then the person, the Social Security representative will say, hey, do you mind if I talk to your daughter about this? And she'll say, yeah, go ahead, go ahead. And then they'll ask, information, what's your name and date of birth and Social Security number, and confirm, who she is. And then they'll look at her ex-husband's or husband's record and see if there's any more money there. And if there is, they'll schedule an appointment. Yeah, you can just call and set up an appointment for her. They are not going to give you info about your dad's Social Security over the phone. They won't tell you the amount or anything like that. Normally, sometimes Social Security, they depends who the rep is. They might, slip or something, but they're not supposed to tell the amounts because they don't know who you are. But if they say we need to schedule an appointment, that means there's more money there. That means there is more money available. If they say, yeah, there's no more money, she's not entitled or something like that, that means there's no more money. And because Social Security is so, backlogged, they don't want to waste appointment time for people that are not going to get extra money. So, let's see, how much can you earn while drawing Social Security? All right. So how much can you earn while drawing Social Security? That's a general question. Let's say you're asking about retirement benefits. So if you're talking about retirement benefits, $22,320. The year you turn your full retirement age, it goes up to about $59,000. Once you hit your full retirement age, you can earn as much as you want. If you're talking about disability, those are a lot different. That's a different answer. But I think you're just talking about regular Social Security. Why do I have to pay $200 a month out of my check SSD? Sounds like probably Medicaid $200. No, it's Medicare. So Medicare, $174, and for Medicare Part B. The Part A is free for most people. If you're having difficulties paying for Medicare Part B, contact your state Medicaid office and see if they'll pay for your Part B. It's called the Medicare Savings Program. It's Medicaid, low income, low resources, but call them up and say, hey, I'm having a hard time paying this $174 for Medicare Part B, and they'll take a Medicaid application. And if you're approved, then they'll pay for your Part B, and you will get other benefits as well, more cost savings in terms of your health care. And you would also be eligible for what's called a Medicare Advantage dual eligible plan, which I recommend if you have Medicare and Medicaid. I usually recommend Medicare supplements, but in that case, if you have Medicare and Medicaid, a Medicare Advantage dual eligible plan is the best plan in most circumstances. All right. Jay Arnold, greetings from Texas. Hey. Let's see. Can I take CalPERS and use my husband's work record for Social Security? Yes, but if you take CalPERS, which is the California system, if you did not pay into Social Security under CalPERS, which like most of them didn't, then 2/3 of that CalPERS offset will offset what you receive. 2/3 of that CalPERS pension will offset what you receive from a spouse. So usually that means nothing, unfortunately, but there are exceptions. Been getting ads on Facebook for Medicare Supplements Advantage plans. People have lots of questions, been referring them to you. Oh, I appreciate it. Thank you. Yeah, that definitely helps out the channel. The people that my team obviously supports this channel, so we can get this information out to more people. But yeah, this is 2025 is going to be a crazy year for Medicare Advantage. So if you've gotten your Medicare Advantage ANOC, the annual notice of change from your whatever health insurance company you have, then make sure you read through it, the fine tooth comb. If you want help, email me, click on that little QR code and say, hey, let's set up appointment in October. And if you keep yours, a lot of people don't know they, well, I like my current doctor and I like my current company. Okay, fine. We'll definitely keep your current doctor. But your healthcare company, they probably have in your area 2, 3, 4, 5, 6 different plans, and they're probably coming out with a new plan next year. So you have the older plan and stay with the same company, same doctor, but upgrade to the newer plan. The company doesn't want you to do that because you're going to be charged more on the older plan that you have. They usually come out with a better plan to entice new people, and they're betting that, which is correct. They're betting you just don't do anything, you just let it ride. And they're like, so that's how they pay all the extra benefits to the new people that sign up, is you pay those benefits because you're being charged more. So don't fall for their trick and review your plans. So there's my spiel on that. Do you recommend blocking Social Security account if number on dark web? Yeah, so you can't really do anything on your Social Security account. Credit reporting agencies and all those people really shouldn't have used Social Security number for credit reports and stuff like that. But it's too late. Yeah, some people do that in terms of the credit card. The credit reporting agencies, the top 3, blocking your Social Security number, but you can't really do that with Social Security. Yeah. And Social Security, didn't lose it. It's for those private companies. Let's see. I made a mistake of opting the Medicare Advantage plan with 0 premium. They don't tell you the difference in benefits, copays, eligible coverage, etc. It won't make that mistake again. Yes, when you're young, 65 years old, and you're healthy and 0 premium, and it's like, well, I can pay 0 premium because I really don't need it. And then later on, maybe I'll get a Medicare supplement, and by that time, it might not be available to you. A lot of people try that. They say, well, I'll do a 0 premium. As long as you're healthy, if you're 66, 67, 68, 70, 75, 80, and you're still healthy, you can probably get a Medicare supplement plan. And depending on which state you are, and there's a whole bunch of other exceptions. But unfortunately, what a lot of people do, 51% get a Medicare Advantage, and a lot of them say, well, I'll just switch to one of the upgrade to the better one later. And then they're not able to because they get sick or they fall or whatever the case may be. Let's see here. Is there a reason I'd be denied for survivor benefits if I was married 26 years? The only reason you would be denied is if you didn't provide proof of your marriage and divorce, or there's no more money there. So your ex-spouse's benefit was $1,500 and you're already receiving $1,600, then there's no more money there, and that's why they would deny you. So you're not really denied, just there's no more money. So summer for January 2025, if you receive less than $1,500 from SSDI, will SSA take $200 from your check, or should I move forward and apply for early retirement at 63? Yeah, if you file for early retirement, your check is going to be even quite a bit lower, another 20% cut. So you don't want to do that. Stay on disability. And so you're talking about Medicare being started taken out in January, the 174 or 185 or whatever it's going to be for January. Again, if you're having a hard time, yes, they will take that automatically. Unless you have health insurance from work, your work, or your spouse's current work, then you don't have to sign up for Part B. But if you don't have health insurance from current work, yours or your spouse's, and you or your spouse have 20 or more employees at that position, then you have to sign up for Part B. If not, you get the penalties. But if you're having a hard time, contact your state Medicaid office and apply for Medicaid and see if they'll pay for your Part B for you. Swiftie has become political. Maybe you could just refer to young people as Gen Zers. Yeah. I just try to use the news a little bit, trying to teach the YouTube algorithm. Yeah. So trying everything I can. If the spouse remarried, does she claim his benefits or can I? Yeah, no, you both can. So if you have an ex-husband that remarried and the new spouse is receiving Social Security benefits, doesn't affect you at all. You can collect Social Security benefits as well. So you can have three people receiving benefits on the same exact record. No problem at all. Uh, let's see. My ex-husband died at age 72 and was working. I started collecting on his at age 62. So yeah, so you sound like that is a strategy. It's a good strategy. Start collecting those survivor benefits and don't touch yours and let yours continue to increase. And yours will increase all the way until you hit 70 years old. So when you hit 70, or 67 or 65, check your own record and see if there's any more money on your own. And then, maybe switch from survivor benefits to your own record. But your record will continue to increase up until the month you turn 70. All right, that is it. We are at an hour. And if I didn't get your questions, apologize. I'll be back again tomorrow. So type your questions in the chat, the first thing, and I'll get to them tomorrow.